Giardia again has two forms. It has a trophozoite and a cyst. Trophozoite is pear shaped or tear drop shape in front view, whereas lateral view, if you see, it is sickle shaped or spoon shaped. In front view, Giardia trophozoite has two nucleus, and which is nearby, it has got two adhesive disc also. These are called as sucking disc or adhesive disc, and this adhesive disc is responsible for adhesion to duodenal mucosa, and that is why again I have to tell you that trophozoites are the pathogenic form, because they are responsible for adhesion to GI mucosa. Apart from that, trophozoites, Giardia trophozoites will have flagella. How many flagella? The flagella numbers are 4 pair. 4 pair means how many flagella? 8 flagella. In contrast, cyst is oval. Cyst is oval, having a remnant of flagella called as exostyle. Remnant of flagella called as exostyle, and 4 nucleus. The mature cyst has got tetranucleus, 4 nucleus, and like amoeba, like Entamoeba histolytica, Giardia cyst also is the infective form as well as diagnostic form. Cyst is the infective form as well as diagnostic form, but what it suggests, if you detect cyst, it may be a carrier. Once in a while trophozoites will be seen, very rarely, but they indicate active infection, same like Entamoeba histolytica. So which is the infective form? Tetranucleated cyst. Pathogenic form, trophozoites. Diagnostic form, usual diagnostic form, cyst indicates carrier, once in a while trophozoite indicates active infection. And what kind of clinical manifestation? Clinical manifestation, the most common form is they produce fatty diarrhea, malabsorption of fat, called as steatorrhea. Malabsorption of fat, called as steatorrhea, clinical manifestation. Then they say that Giardia is the hepatitis duodenal parasite. The habitat of Giardia is duodenal parasite. So now you tell me the chance of detection by stool microscopy is less or more compared to Entamoeba histolytica? It is less sensitive because it is a duodenal parasite. If stool microscopy is negative, then you can directly aspirate the sample from the duodenal site by a test called as string test or entero test. String test or entero test is done to directly collect the sample from the duodenum by string, by giving the patient, by asking the patient to swallow a string attached to a gelatin capsule, which will collect the sample, and if you pull the skin, the specimen will come out. String test or entero test. Fine.